Hello all, this is Mrs.Lalithamani.D, Associate Professor from SNS College of Nursing. Every month we are learning about a lecture series where we will be discussing about a new topic or the continuation of the topic. So in the last month we have seen about what are the definition of meningitis, how it is happening, and what are the clinical manifestations or confirmatory. Now we will see about the investigations, management, and how to handle the patient with meningitis. So when we say the investigations include the lumbar puncture, which is a cerebrospinal fluid in which it is collected from the thecal sac that surrounds the spinal cord. So when we see this, the patient will be having an idea of having the cerebrospinal fluid being taken up in the unilateral side. The cell count, that is the WBCs and RBCs, will be checked. Then protein level, glucose levels will be monitored while taking the sample from the lumbar spine. So lumbar puncture is an investigation. The next one is gram stain culture and culture to identify the bacteria. Which kind of bacteria? Viral PCR. PCR is polymerized chain reactions to detect the viruses. So in the case of fungal stain and culture also will be taken. Along with that, we will be going in for blood cultures. So when we talk about the blood sample, one thing is we will be going in for complete blood count, which is a normal routine investigation, and imaging studies include CT scan and MRI. So this will be giving a clear picture on how the things goes on. The next one will be the medical management. How a patient with meningitis will be handled. So how to manage a patient with suspected bacterial meningitis? In this case, there are two options. In the image you can see there is a major two options. One is isolation. It is to prevent the spread of infection, and the second category is supportive care. It is a supportive care. So it ensures the patient stability and manages symptoms. So this one manages the symptoms. So one is isolation and the second one is supportive care, which comes under the medical management. Coming on to the pharmacological management. As we know, the medical management can be done along with the pharmacological management, that is a drug therapy. So there we will be seeing about the antifungal category of drug being administered, antivirals, antibiotics, and corticosteroids. So when a patient is with any of the positive symptoms of viral, bacterial, or any other organism infestation, we will go for this. So antifungal, antiviral, antibiotics, and corticosteroids. The other category is what are the commonly used drugs. One is antibiotic. It is ceftriaxone, vancomycin, and ampicillin. So the antibiotic three categories: ceftriaxone, ampicillin, and vancomycin. So antiviral, the commonest drug will be acyclovir, and the antifungal drug will be amphotericin B and fluconazole. So when we talk about this corticosteroid, it is very well known that the dexamethasone is the most commonest corticosteroid that is being administered. So the drugs given: antibiotics three categories, antivirals, and the corticosteroids. Coming on to the surgical management, the surgical intervention is rarely being done for meningitis, but it is done to manage the complications, as like in case of hydrocephalus, where the hydrocephalus, in a patient with hydrocephalus, we understand that there is an increased fluid collection inside the cerebral cavity. So the placement of a ventriculoperitoneal shunt, that is a connection that is happening between the ventricles in the brain to the peritoneum. Okay, so in that case it is used to drain excess CSF and the subdural empyema, that is drainage of the pus collection which is being present in the spinal column. So in the picture you can see before shunt and after shunt. And the next category is the nursing management. Assessment includes vital signs, unconsciousness, neurological sign, fluid electrolyte imbalances, and evaluate the complication like seizure, septic shock, respiratory distress. Also we need to find out any warning signs of complications, that are headache, nausea, vomiting, altered mental status, etc. So a nursing assessment is to identify the factors. Coming on to the complications, we will be able to rule out the complications like there will be a brain damage, trouble walking will be seen. Patient will be ending up with multiple organ failure, hearing loss, memory problems and learning disabilities. So when we talk about these complications, it will be very important that we need to track or find out the complications which are being denoted as to go with the signs and symptoms. One is brain damage, trouble walking, multiple organ failure, hearing loss, memory problems and learning disabilities. So early identification of the complications will definitely have a positive impact on prognosis. Then coming on to the nursing assessment, as we have seen already, they are the monitoring the vital signs, neurological status, everything. So until now we have seen about the meningitis, its investigation, management, including pharmacological, nursing and surgical. Thank you until we see the next video.